Are you a woman, or do you have a woman in your life that you care about? If you do, the topic of ovarian cancer should be important to you because it is one of the largest causes of cancer death among women. Ovarian cancer is a very devastating disease, but it can be treated. To illustrate this, we will take a look at symptoms, what ovarian cancer affects, treatments, and the survival rates. The first thing I will talk about is the symptoms of ovarian cancer. Ovarian cancer is often overlooked until it is too late because there are not very many noticeable symptoms at first. According to the Mayo Clinic, published May 9th, 2023, signs and symptoms of ovarian cancer may include abdominal bloating or swelling, quickly feeling full when eating, weight loss, discomfort in the pelvic area, fatigue, back pain, changes in bowel habits such as constipation, and a frequent need to urinate. When several of these symptoms are presented, you or your loved one should be checked out by a doctor. At least if there's several within a few weeks or a couple months, should definitely be checked out because you could have ovarian cancer. Now we took a look at the symptoms. Let's see what this cancer actually affects in the female body. In an article by the Cleveland Clinic, published the 14th of November of 2022, they said, ovarian cancer occurs when abnormal cells in your ovaries or fallopian tubes grow and multiply out of control. So I'm going to show you where this is. That would be right here, is what the cancer ovary looks like compared to the normal. So ovarian cancer only affects women, and it is most commonly found in the white or Caucasian population, also popular among the Native Americans. The risk of developing this cancer is actually around 1 in 78 in women, which is pretty common if you think about it. Because, to put it in perspective, approximately 6,220 women are in Canton, according to the Census Bureau Quick Facts with no author or publication date. Out of those women, around 80 of those 6,200 could most likely develop this cancer. So next, we will take a look at the treatments and the survival rates of this ovarian cancer. When you are diagnosed with ovarian cancer, you'll be referred to a gynecologic oncologist. This is a doctor who specializes in female cancers, and they will go over treatment options for the ovarian cancer. There are a few different options for treatments depending how bad the cancer is and what stage it is also in. According to the CDC, published February 20th, 2024, these options are surgery, which is an operation cutting out the cancer, chemotherapy, which is use of special medicines to shrink or kill the cancer. The drugs can be pills you take or medicines given in your veins, sometimes both. Use of drugs to block the growth and spread of cancer cells, which is called targeted therapy. The drugs can be pills or medicines given in your veins. You will get tests to see if targeted therapy is right for your cancer type before that certain treatment is used. The survival rate for ovarian cancer is typically a 5-year rate. On average, according to the American Cancer Society, published March 1st of 2023. Lastly, we will take a look back at what we have learned throughout this speech. So ovarian cancer is a very devastating disease, but it can be treated. We took a look at all the symptoms, what ovarian cancer really affects, the treatments, and the survival rates. In conclusion, ovarian cancer is a very serious and scary disease that is common among women. So if you are a woman or have a woman in your life that is important to you, you should know the symptoms and what to look for in ovarian cancer. Thank you.